This video demonstrates amniotic membrane transplantation in a patient who's had a full thickness corneal graft. This is for protection of the cornea in high-risk patients and as an anti-inflammatory bandage. So here I've already thawed the frozen membrane and kept it moist, rinsed it with BSS, and now I'm using two non-toothed forceps to spread the amniotic membrane out with the epithelial side down, which is the surface that does not stick when you touch it with a spear. So here I'm spreading the membrane out to make sure there's no folds, and spreading the corners out, and the corners are where I'm going to take the bites for the continuous suture. So it's important you cut the amnion to the right size just so it overlaps the limbal area. So here I'm taking bites through the limbus and catching the membrane with 10-0 nylon. I usually use 4 bites for these kind of membranes where I'm just using it as a temporary protection for the corneal graft. So the purpose of this is to keep it on for around 2 to 4 weeks with a bandage contact lens on top. So here I've done all 4 bites and I'm just tying the suture relatively tight but not over tight because it does slacken quite quickly. And it's important to keep the membrane wet and avoid manipulating with spears. And now I'm tying the suture, and just sometimes I do bury the knot, but most of the time I leave it exposed as I put a contact lens on top. So just final points, it's important to make sure the membrane is covering the area that you're trying to protect. It's important to make sure the membrane is flat and not loose at any point. Here I'm giving some steroid subconj, and then I put a contact lens over the top.